Hello and welcome. Let's start talking about reproductive system. Chapter 27 is what you guys have here. And when we talk reproductive system, the reproductive system you'll see is going to be, first of all, made up of our primary sex organs. And when we talk our primary sex organs, we'll see our primary sex organs, and we'll be referring to our gonads, And when we talk gonads or primary sex organs, we're talking testes in males and we're talking ovaries in females. Second, you have your accessory reproductive organs or your secondary sex organs. And we'll go through each of those as well. Jumping back to our primary sex organs are going to be important because they produce, and we'll see they secrete a couple of important things. Number one, they produce gametes, or what we can also refer to as sex cells. Not S-E-L-L-S, but C-E-L-L-S. Next, then, they secrete a variety of steroid hormones that we refer to as sex hormones. So then the secondary sex organs, the accessory reproductive organs, you'll see in the males, it'll include ducts, glands, and the external genitalia. In the female, we have uterine tubes, the uterus, and the vagina. Excuse me. So the first thing here we can check out now, after we've laid out the basics there, is the differences between the reproductive system and other major organ systems. Now, when we go through and we talk about the function, you'll see, number one, the function of the reproductive system is not to maintain the well-being of an individual. That's really the function we can see of all these other organ systems that we have. Now, when we talk about this reproductive system is slumber. It doesn't work until puberty. It doesn't kick in fully until puberty. So when we go through and we talk about the functions of the reproductive system, the functions, we'll see, number one, a common function, and the common function for both male and female reproductive systems is to produce offspring. It's to produce offspring. Even though male and female reproductive organs are different, they have this common function, and it's to produce offspring. Now, when we talk specific for male function, you'll see male function, in a specific function of male reproductive organs, we'll see is going to be to manufacture male gametes that are called sperm and deliver them to the female reproductive tract, where fertilization occurs. Now, when we talk specific to female is, again, also to produce now gametes, but female gametes, right? Ova or eggs. And if fertilization occurs, its function is to maintain the fetus. The organs then will maintain the fetus. So let's go through and let's check out then, we'll check out the differences between external and internal genitalia there. And then we'll go through some of the secondary sex characteristics also. Let's check out first a couple of genetics components here as well. Now, sexual reproduction is what basically we exhibit, and this involves two parents, right? Now, both parents will contribute half of the genetic makeup, helping to basically form, so 23 pairs of chromosomes that we have, right? So half coming from mom and half coming from dad. So 23 come from mom, 23 come from dad. So it's going to involve two parents. Now, gametes, you got your sex cells, we've spoken about those. Zygote is the fertilized egg. And males, the difference you should know there from biology as well. I'm sure the chromosomal difference between male and females in bio, we do a really good exercise where you mate with coffee stirs. And it really gives you that idea and puts everything into perspective of how traits are passed on and how even chromosomes for the different sexes basically are made and whatnot. So you can see there males have penis for introducing sperm to the female reproductive tract, and the females have a vagina for receiving that sperm. So we'll go through all those different parts and check that out there as well. So all the different structures you can see there, external versus internal. Here, let's start with then male. A good image there, and we have a nice image here as well. Here they're highlighting everything. You can see urinary along with digestive and repro. Here what they've done is they've basically highlighted mostly reproductive and few, obviously the two systems, urinary and repro, intertwine in the male a lot. So you can see here a lot of the urinary components are highlighted as well. So here when we go through male, let's talk first testes. When we talk about the testes, they lie within the scrotum. They're found lying within the scrotum. They're about 4 centimeters long and about 2.5 centimeters wide. The testes, they're going to be found surrounded by tunics, and we'll go through those tunics there as well. Now we talk about the function of the testes. The function of the testes is to produce sperm. Produce sperm. So let's go through the different structures now in relation to the testes. First, we have what we call the tunica vaginalis. So let's do this. Let's move over to this image right inside of here, where now we can appreciate the tunica vaginalis. The tunica vaginalis is a 2-layered outer tunic. It's basically the serous layer, and it is derived from the outpocketing of the peritoneum. It is derived from the outpocketing of the peritoneum. That's the tunica vaginalis. Now in the lab, when you dissect this on the cats and the male cats, it's basically, I described this part like having to dissect a layer off of a grape is kind of what you're doing here now. It's very delicate. It's right on that testy there as well, and it's a really good idea. It gives you really that idea of it being a 2-layered outer tunic. So tunica vaginalis. And then we've got the tunica albuginea. The tunica albuginea is the deeper fibrous capsule. It's basically, you can see the white coat. It's the white coat, and it forms septae. The tunica albuginea does. It forms septae that divide the testes into about 200 to 250 lobules. And each of these lobules are going to contain, you can see, these seminiferous tubules. The seminiferous tubules are the actual sperm factories. They are the actual sperm factories. They're surrounded by 3 to 5 layers of myoid cells, and we'll look at that in greater detail. Right inside of here. So let's do this. Here you can see if we were to go and make a cut right through here and turn basically that seminiferous tubule around, here you could appreciate now a nice cross section through the seminiferous tubule. And then here you can appreciate the myoid cells. They're smooth muscle-like cells, and they squeeze sperm and testicular fluid out of the testes. They're going to help squeeze sperm and testicular fluid out of the testes. So here you could see when they contract, here they're going to be basically causing an effect, you could say exhibiting their effect on these components inside of here. So when these seminiferous tubules do basically their thing, you can see here then sperm is going to be routed into the straight tubule. So the straight tubule is going to be basically marking the exit point from those seminiferous tubules, leading us into this tubular network we can see here on the dorsal aspect, the dorsal superior aspect of the testes, called the ready testes. The ready testes, a tubular network on the posterior side, and it receives sperm from the straight tubules. Next, then, coming back here, we can also appreciate, we're going to see interstitial cells or Leydig cells. They're going to be lying in the soft connective tissue that's surrounding those seminiferous tubules. They're found in the soft connective tissue. And they produce androgens. Most importantly, we've spoken about already. Very good. Testosterone, right? Next, then, here we've got our external genitalia. Now, when we talk external genitalia, first we can appreciate the scrotum. Now, when we talk about the scrotum is a sac of skin. It is a sac of skin and superficial fascia that's going to be found hanging outside the abdominal pelvic cavity at the root of the penis. It's covered with a sparse amount of hairs, and it will contain within it the pair of oval testes. The function of this scrotum is to keep the testes at a temperature that's slightly lower than that of the rest of the body. So let's go through the actual structure then of the scrotum. Let's go through and we'll see there are going to be two sets of muscles that are going to be found here. First layer of muscles we have here is called dartos muscle. It's a layer of smooth muscle in the superficial fascia. It wrinkles the scrotal skin. So here you can appreciate the skin, and then deep to the skin you can appreciate the superficial fascia that contains dartos muscle. Then we can appreciate the spermatic cord here. It's been opened up. It's been fully opened up here. So the spermatic cord, now you can see, is a connective tissue sheath. It contains nerve fibers. Blood vessels. We can see on the other side, lymphatics as well. And this structure, the spermatic cord, is going to pass through the inguinal canal. It passes through the inguinal canal. You can see it passes right through the inguinal canal, making its way down into the spermatic the spermatic cord makes its way down into the scrotum. Then here we can appreciate cremaster muscle. Now when we talk about cremaster muscle, the cremaster muscle you can see is going to be bands of muscle, and it's bands of skeletal muscle that are going to arise from the internal oblique muscle as the testes pass from the abdominal cavity down into, you can see, the scrotum. So as the testes pass from that abdominal pelvic cavity into the scrotum. This cremaster muscle elevates the testes. It elevates the testes and allows the testes to move closer to the body if ambient temperatures fall to lower temperatures, or if ambient temperatures get too cold. We'll see we need right temperature for sperm production. So too hot and too cold, then the testes are adjusted there. Either closer to the body if it's too cold, or moved away from the body if then the body temperature starts to rise. Next, then we can appreciate the pampiniform venous plexus, the testicular artery inside of here as well. Now, these are going to be long branches from the abdominal aorta, and they supply the testes. And the pampiniform venous plexus is going to be draining the testes into then the inferior vena cava. So it goes pampiniform venous plexus, then to the testicular veins, and then to the inferior vena cava we'll see eventually. More specifically there, you'll see when you get there. Sensory nerves. Sensory nerves, we'll see the testes are going to be richly supplied with sensory nerves. Next then we've got the penis. The penis is the copulatory organ. It is a copulatory organ. The function of the penis is that it's designed to deliver sperm into the female reproductive tract. Number one, designed to deliver sperm into the female reproductive tract. Number two, it's going to remove waste. It will remove waste products, or waste fluids even, from the body in the form of urine. Let's talk about some of the structures in relation to this penis. First, we have what we call the glans penis. The glans penis is the enlarged tip. And it's covered by what we refer to as the prepuce, or the foreskin. It's a loose skin covering found around the glans penis, the foreskin. Next, then we have the shaft. When we talk about the shaft is basically the body of the penis. And this body is, you could see, constructed of two parts. First, you have what we call the corpus spongiosum. The corpus spongiosum is the inner layer. It's the layer that's found directly surrounding the urethra. The inner layer found surrounding the urethra. And you can see this corpus spongiosum expands distally, forming the glans penis, and proximally forms the bulb of the penis. Surrounding the corpus spongiosum is going to be the corpora cavernosa. So here then we can see the corpora cavernosa bilaterally. Well, it looks like that here, but it's going to be, you can see, making its way around, and then on the bottom of the penis is where we'll have this, basically this two sides fused together. And we'll check that out there as well. So here we'll see when we talk corpora cavernosa, the outer layer around the urethra makes up most of the penis. You can see it makes up most of the penis, and it's surrounded by Tunica Albuginea. And it's surrounded by Tunica Albuginea. Now you can see that here, if we were to make a cross section through there, you can see that Tunica Albuginea basically surrounding all of that layer right outside of here. And here we can see proximally it'll give rise to the crus, the crura basically. So let's talk about then the root of the penis. Now we talk about the root of the penis. The root is where we're going to find the bulb, and we can find the crura. So the bulb is covered externally by bulbospongiosus muscle. The bulb is covered externally by by bulbospongiosus muscle, and it is secured to the urogenital diaphragm. It is secured to the urogenital diaphragm. Next then here we can appreciate the crura. The crura are basically, you can see, found lateral then to the bulb. The bulb is going to help to anchor that penis to this urogenital diaphragm. Next then here we can see, when we talk foreskin, surgical removal of the foreskin here is referred to then as male circumcision. Next then we've got the duct system. The duct system is responsible for taking sperm from the testes to basically the body's exterior. It's continuous with the tubules of the testes, the duct system is. So here, let's look at, basically you can appreciate first this epididymis. The epididymis is this cup-shaped structure found surrounding that dorsal aspect of the testes, cupping, you can say, the dorsal aspect of the testes. And its function is to house sperm. Its function is to house sperm. And here you can see that very well. In the cats, this is what it needs to look like. This is what it needs to look like in order for you to get your points. You have to remove the layers that we discussed. All right, we said first we have that tunica vaginalis. You need to remove that tunica vaginalis for it to be able to look like this. So here then is the epididymis. Its job, its function is to house sperm. Here now we'll look at the different structures of the epididymis. First we have the head of the epididymis, leading us then to the body of the epididymis. So the head, you can appreciate, you've got the efferent ductules. They cap the superior aspect of the testes, and they take sperm from the ready testes. The efferent ductules, and bring that sperm then into the epididymis. The efferent ductules then, you can see, bring that sperm into the head of this epididymis. Then here you can see all of these ductules eventually are going to start to come together. And then here we can see we have the body, and the body is mostly constructed up of, you can see, just this one duct now that passes through, leading us to the tail. And here you can see that duct of the epididymis curling around, making a U-turn, and making its way back up. Makes its way back up all the way through as the ductus or the vas deferens. The ductus deferens or the vas deferens, we can see now, is responsible for taking this sperm. It'll take this sperm from the duct of the epididymis. Here you can see the vas, and brings that sperm now into the ampulla. So here you have the ampulla. The ampulla is basically the terminal part of the vas. It's found at the end. And it will join the duct of the seminal vesicle that's found right near it. It'll join that duct to empty their secretions into this little duct here, the ejaculatory duct, which you can appreciate in greater detail right inside of here. So here you've got the ejaculatory duct right inside of here. And here you have the urethra that we've already gone through and we've talked about. So the ejaculatory duct receives secretions from the seminal vesicles and secretions from the ampulla, and it directs those secretions into, then, you can appreciate here, the urethra. Here we've got urinary secretions, basically urine coming in. You'll learn in physiology, all of these pathways are going to be shut then. So that way, sperm has only one pathway to take. And we don't have any reflux up into here or anywhere else. So the ejaculatory duct, it enters and empties, as you can see here, enters into that prostate. It's in that prostate gland. It empties into the urethra. The urethra we've discussed, divided up into 3 divisions: prostatic, membranous, and spongy. So go through and know those divisions there as well. And then here we've got the external urethral orifice, which will allow, we said, urine to make its way out. And here you can see sperm as well to make its way out. So here you can see in the male, the urinary and the reproductive organs are found in close proximity. And here you can see is where the two come into contact with each other. In the female, we don't have this. Urinary, okay, and reproductive are going to be separated there. You have urinary in the front, basically here, reproductive next, and then you can see GI there at the end. So in the female, this doesn't connect like we see here. This remains separate. So you have the urinary, basically, that's why I said then reproductive next, and then GI. Let's look at and let's talk about the accessory glands. Now here you have some accessory glands you can appreciate. First, we're going to see the pair of seminal vesicles. We also have a pair of bulbourethral glands and the single prostate gland. So you can see from here, seminal vesicles, large, hollow glands. They're found lying at the posterior bladder surface. Prostate gland we've got next. And you can see here why we do digital rectal exams in the male for a prostate gland test. The close proximity. Right? Trained physicians. So here then we can see the prostate gland. It's a single gland, a donut-shaped gland. It's about the size of a peach pit. About the size of a peach pit. And it encircles the urethra, inferior to that bladder. So you should be able to put together why patients with an enlarged prostate can't empty their urine all the time. Blocks off that pathway. Next, then, we can appreciate here the bulbourethral glands. When we talk bulbourethral glands, they are pea-sized glands inferior to the prostate. Inferior to the prostate. So what they do now, all these glands, what they do is they secrete secretions. So when we talk about semen, semen is sperm, which came from the testes, testicular secretions, plus secretions from these various glands. And that's what semen is. So let's talk then sperm. Now when we talk sperm, here we can appreciate a nice view of sperm. Here you can see we've got the different phases of meiosis. Meiosis 1 through meiosis 2, so make sure you review those there as well. So you're familiar with basically those different phases and exactly what's happening there, and you understand, again, a review from biology, why we have genetic variability. So here you can see then, at the end of meiosis 2, we're talking males, we have sperm produced, right? How many do we have produced? If you said 32, you're right. Right? No. 4 functional sperm. So this is the structure of one of those sperm. Here is the phase of growth for that sperm. It starts off, you can see here, in a very immature stage, moving all the way through, becoming then a mature sperm. So moving back in here, you could see all the different events that are taking place in the cell. Here, we can appreciate all of those different events within the testes. So here you can see you've got type A spermatogonium, which is going to be found along the basement membrane of those seminiferous tubules. That cell then, the type A spermatogonia, divides, giving rise to 2 cells. The type B spermatogonia is going to continue through spermatogenesis. Type A cell is going to stay, we'll see here. So we've got the stem cell basically that gives rise to the 2 cells. Now the 2 cells, this cell will stay here, and this cell then is going to continue forward. So here you can see it goes through meiosis 1, giving rise to 2 daughter cells, which then go through meiosis 2, giving rise to 4 daughter cells. And here you can see the 4 sperm we mentioned. So we look at 1 sperm, okay, is what we're looking at here when we're looking at basically the mature sperm, or what we're seeing right inside of here. So here you can see, first we have the type B spermatogonia, which becomes a primary spermatocyte, which becomes then secondary spermatocytes, which become then spermatid, which undergoes spermiogenesis to become sperm, metamorphosis. And then here you can see the sperm. You got to know all the different parts there also. You got the head. The head's important because the head's going to contain the nucleus, which is going to contain compacted DNA. Along with that, you can appreciate here acrosome. The acrosome is going to be lysosome-like, and it's produced by the Golgi apparatus. And this lysosome-like material, it contains hydrolytic enzymes that are going to enable the sperm to penetrate and enter an egg. The midpiece is important because the midpiece is going to contain, you can see a lot of mitochondria. And you all learn in mitochondria, you all learn in biology what mitochondria do. Then here we've got the tail. The tail is a flagella. And I'm sure you probably went through the structure there as well. A flagella, a dinine structure. Okay, 9+2 arrangement of microtubules. And all of that, I'm sure you've gone through that. Check that out. So let's move. Okay, get spermatogenesis down there as well. Let's move back here and let's talk vasectomy. Vasectomy now is a surgical procedure where basically you could see then this vas deferens its pathway is going to be basically separated. And some physicians will go in and they'll put sutures in a couple of locations there and try to block that pathway off. And you have to come for a follow-up to make sure the pathway is blocked off. Okay, and then many cases where people don't come back for the follow-up and they think it's even blocked off sometimes, and pathway is not fully blocked off. So that's why they'll check there and make sure that the pathway is blocked off. And next, then let's move to female reproductive system then. So let's talk female reproductive system. So when we talk female reproductive system, here then we're able to appreciate. So let's talk then female reproductive tract. So here when we talk female reproductive tract now, here we can appreciate, first we'll have what we call the ovaries. Let's move over to this picture right in here. Now here we can appreciate the ovaries, which are the female gonads. Here one image they're depicting the image of the ovaries closed completely. You can appreciate them from their external entirety, and then here we've got a nice, basically a cut right through, depicting to us then the internal aspect of the ovaries. So here now when we go through and we talk about the ovaries, they're the female gonads. They're found flanking the uterus bilaterally, right? You can see on both sides, they're flanking the uterus. They're shaped like an almond and double its size. Shaped like an almond, but double its size. We get very happy, very excited when we get to appreciate these female parts in our female cadavers. Most of the cadavers usually have had hysterectomy, full hysterectomy, where they've even had the ovaries removed, and you're not able to appreciate anything there. So when we do get to see them, we're real thankful and we're really appreciative of that. Now when we go through and we talk function of the female ovaries is to produce female gametes. They produce female gametes, right? The ova is number one. Number two, sex hormones, estrogen and progesterone. Next then here, let's go through the different structures. Here we've got first our ovarian ligament. You can appreciate the ovarian ligament. The ovarian ligament is going to be found suspending or anchoring the ovaries medially to the uterus. Found flanking the ovaries medially to the uterus. You can see that there very nicely on both sides. Next in here we can appreciate the suspensory ligament. So ovarian, anchoring the ovaries medially to the uterus. Bilaterally you can see that. Suspensory, you don't see bilaterally, you're just able to appreciate on one side. So the suspensory anchors basically the ovaries laterally to the pelvic wall. Laterally to the pelvic wall. Then we have the broad ligament. Broad ligament lives up to its name. The broad ligament is a peritoneal fold. It's a peritoneal fold that tents over the uterus and supports the uterine tubes, the uterus, and the vagina. It also encloses the ovarian ligament and these vessels. Next we've got germinal epithelium. Germinal epithelium is going to be a layer of cuboidal epithelial cells. Layer of cuboidal epithelial cells. And they're going to be found surrounding the Tunica Albuginea. Found surrounding the Tunica Albuginea. And this germinal epithelium is continuous with the peritoneum. It's a continuation of the peritoneum. So next time when we talk about the Tunica Albuginea, the Tunica Albuginea, I've heard it pronounced as well, okay, is the fibrous surrounding, it's the fibrous surrounding of the ovaries. The fibrous surrounding of the ovaries. All Tunica Albuginea. Now these ovaries you can see are divided up into two parts. They get divided up into two divisions. You have the cortex, and then we have the medulla. Now when we talk cortex, the cortex is the outer part. It's the outer part, and it houses the forming gametes. It houses the forming gametes. The medulla you can see inside of here. The medulla is going to contain the blood vessels. The blood vessels that are responsible for nourishing these growing oocytes. In the cortex, we can appreciate all these various follicles. These follicles you can see are all in various stages of growth. These follicles are tiny sac-like structures. They're tiny sac-like structures that are embedded in the highly vascular connective tissue of the cortex. The follicles you can see contain the ova, the oocyte. After the follicle has released the ova during ovulation, it happens, they describe it as happening about midway in the cycle. After the oocyte has been ovulated, you can see what's left is basically the corpus luteum. The corpus luteum. The corpus luteum is a glandular structure that's formed from the ruptured follicle after ovulation. And it's got an important task as well. Next thing we can see is the duct system. The duct system. Now the duct system here in the female reproductive tract has little or no actual contact with the ovaries. The ovaries you can see are basically seated there like this, and then the duct system is found right above it. So there's little to no contact between the two. Okay, you can see they're separated. So here now, when we talk, we're talking about now the uterine tubes, the fallopian tubes, the oviducts, whatever you want to call them. Now these fallopian tubes, the uterine tubes or the oviducts, they're about 4 inches long. And their function is to receive the ovulated oocyte. It's to receive the ovulated oocyte, and they are the site where fertilization occurs. So let's go through the various structures of the oviducts. Now when we go through the various structures, first we have what we call the infundibulum. So the first division is the infundibulum. It's the open end of the fallopian tubes. Here it's open as well, it's opening into the uterus. Here it's actually opening out into, basically, you can think of the pelvis. So it's the open end. And here when we talk about the infundibulum, it's a funnel-shaped side. You can think of it as being the funnel-shaped side. And it bears cilia, and it's going to contain cilia. Also coming off of the infundibulum is these fimbriae. Here you can appreciate those fimbriae in greater detail. These fimbriae are going to be tiny finger-like structures. They're tiny finger-like projections that are ciliated. And why do we have all the cilia in there? To help bring that egg inside and bring it into this oviduct. Sweep it into the oviduct. Next then we'll appreciate the ampulla. The ampulla is the region where fertilization occurs. From the ampulla then, the oocyte, or that fertilized egg, can make its way then into the isthmus. The isthmus is this segment that, it's a segment of this uterus that, it's a segment of the fallopian tube that connects to the uterus. It's a segment of the fallopian tube that connects to the uterus. And then we've got the uterus. If we have implantation take place anywhere in here, that leads to ectopic pregnancies. Right, we have to go in and remove that. And then the couple will try again. Next in here, we're able to appreciate the internal aspect. Now, when we talk about the internal aspect, we've talked about ciliated and non-ciliated cells. So make sure you review that from the beginning of the semester, and we've gone through that, we've talked about that, and we've talked actually what each of those cells are doing there as well. So make sure you review that there and get that checked out. And then you got your broad ligament. We've talked about the broad ligament. The broad ligament itself is so broad that you can see here it gets divided up into various parts. So make sure you know all the divisions, the mesosalpinx, the mesoovarian, the mesometrium as well. And make sure you understand every single division basically of that broad ligament there also. Next then here we can appreciate the uterus. So when we talk about the uterus, the uterus is going to be described as an upside down pear-shaped structure. The uterus is located in the pelvis, anterior to the rectum, and posterior superior to the bladder. The function of the uterus is to receive, retain, and nourish a fertilized ova. Let's go through the structures of the uterus. First, we have the fundus. When we talk about the fundus, just like the stomach, is the dome-shaped part. It's the rounded superior region. It's found located superior to the entrance of the fallopian tubes. That's the fundus. Next, then we have the body of the uterus. The body is the major portion, the mid portion you can think of. That leads us then to the isthmus. Here then we can appreciate the isthmus. The isthmus is the constricted region. The isthmus then takes us over to the cervix. The cervix is the narrowed neck or outlet. It projects inferiorly into the vagina. When we talk about the walls of the uterus is made up of 3 layers. So the uterine wall has 3 layers. You have first outside here the perimetrium. It's an incomplete outermost serous layer of the uterus. Internal to that you have the myometrium. The prefix myo should tell you everything you need to know there. Right? We have skeletal muscle inside of here. Oh no, it's cardiac muscle because it contracts, right? Very good. Cardiac muscle. Smooth muscle. Then you've got the endometrium. We talk endometrium. It's the mucosal lining of the uterus. It's the mucosal lining of the uterine cavity. It's simple columnar epithelia underlain by lamina propria. So let's look at that endometrium then in greater detail. When we look at that endometrium in greater detail, here we can appreciate that. Here you can appreciate now first what we call the stratum functionalis and the stratum basalis, the 2 layers of that endometrium. Okay, and then you can see again the muscle underneath. So here you can appreciate the muscle underneath. All smooth muscle right inside of here. So stratum basalis, basal layer, and stratum functionalis. Stratum functionalis is the functional layer. This is the layer that undergoes cyclic changes. It undergoes cyclic changes in response to levels of ovarian hormones. This is the layer that gets shed during menstruation. Deep to that, we said, is the stratum basalis, the basal layer you can think of. The stratum basalis is responsible for forming a new stratum functionalis every month. Along with that, you can look at the vascularity there. Look at how much vascularity is going to increase then, as well as basically we move away from the actual menstruation part of this whole ovarian cycle and uterine cycle. Next then, we've got the round ligament. The round ligament is going to anchor the uterus to the anterior body wall. You can appreciate that there very nicely. Then we can appreciate the vagina. When we talk about the vagina is a thin-walled tube, about 3 to 4 inches long, and it's found lying in between the bladder and the rectum. Lying in between the bladder and the rectum. And it extends from the cervix to the body's exterior. So it extends from the cervix to the body's exterior. When we talk about the function of the vagina, the function is it's a copulatory organ. It receives the penis during sexual intercourse. It also provides as a passageway. It provides as a passageway for the delivery of an infant. And also it provides as a passageway for the delivery of menstrual flow. Let's go through then some structures here, and let's look at this view of basically the vulva. We can see here now. Here, this one, you can see it's a little more detailed here. Here we can appreciate, number one, vaginal fornix. Now, when we talk about the vaginal fornix, jumping back here. The vaginal fornix is going to be this recess, this space that's going to be found surrounding the cervix. That's the vaginal fornix. Next then here we can move back. We have the hymen. The hymen is an incomplete partition that's formed by the mucosa near the distal vaginal orifice. Then we can appreciate the external genitalia. Now when we talk about the external genitalia, here we have first the labia majora. The labia majora are going to be two elongated, hair-covered, fatty skin folds. They are two elongated, fatty, hair-covered skin folds. Next up, we can appreciate the labia minora. The labia minora are going to be two thin, hair-free skin folds. And they are enclosed by the labia majora, you could see. They are enclosed by the labia majora. Next in here we can appreciate the vestibule. The vestibule is a recess. It's a space you can think of. It's a recess which contains the external openings of the urethra and the vagina. So here we've got the vaginal orifice. The vaginal orifice now is the opening for the vagina. And then the urethral orifice, we've got the opening of the urethra. And here we can also appreciate the greater vestibular glands. So here's the opening of those glands. Their ducts open right over there. And this is what you see underneath the skin then. The greater vestibular glands. They're pea-sized glands that function to keep to lubricate or keep the vestibule moist. They're pea-sized glands that keep the vestibule moist and lubricated. Next, then we can appreciate the clitoris. So here then we've got the clitoris. It's a small protruding structure. It's homologous to the penis of the male. It's composed of erectile tissue and sensory nerve endings. Here then we can appreciate that clitoris without, and it's also known as the glans, okay, or you can see this part that we can see is basically visible here is the glans. Okay, so that's what we're seeing here. The rest of it is covered, again, by now prepuce or foreskin. So some cultures, some religions, they believe in removing the foreskin in females, males, or just females, or whatever you have there. But nonetheless, this is what gets removed there. Next, then we have mammary glands. Mammary glands. Now we talk mammary glands. Mammary glands, we'll see, are present in both sexes. They're present in both sexes. However, they normally function only in females. And their function then is to produce milk, which will help to nourish a newborn baby. Now, when we look at the structure of the breasts and the structure of the mammary glands now, we can see first its skin. Beneath the skin, then, we're able to appreciate how basically you have this organization of these glands underneath the skin and above the muscle. So here then you can see how these mammary glands are divided up into about 15 to 20 lobes. 15 to 20 lobes that are going to be found surrounding the nipple and opening at the nipple. Surrounding and opening at the nipple. Now, between each of these lobes, you can appreciate suspensory ligaments. These suspensory ligaments are basically interlobar connective tissue that attaches the breast to the underlying muscle fascia and the overlying skin. Here you can appreciate alveoli. These alveoli are going to produce the milk when the female is lactating. It'll make its way then into the lactiferous ducts. From then the lactiferous ducts, this milk is going to make its way up into the lactiferous sinuses. So this is where milk accumulates during nursing. And here we can appreciate the nipple. And you can see how all of these different basically ducts then are going to open up at the nipple. And then surrounding the nipple, so the nipple is centrally located on the breast. Surrounding the nipple then is areola. Areola is all pigmented tissue. It's a pigmented ring of tissue. So there we have then the mammary glands. And we said when we talked in integumentary system that we would talk about them here, and here we are. Let's go to then the development of the external genitalia. So here we have, before we take off to there, oogenesis. Right? Meiosis 1, meiosis 2 in the female. And in the female then, the final product, the end product of meiosis is 32 eggs, right? How many eggs? How many functional eggs? 5? 4. No, 4 like the male, right? 4 functional eggs, correct? Right? Same in male and female? Nope, nope, nope. 1 functional egg. And you have basically 3 polar bodies, if you recall from biology. So make sure you've got all that down there and understood. Right, it's the SRY gene that codes for testes determining factor. That's going to allow then the male parts to come in, the Wolffian ducts. If the SRY gene is not present, Müllerian ducts, basically Müllerian parts, are going to form. So here then we can appreciate the indifferent stage. Now at this indifferent stage, you can appreciate a few structures here. First we have what we call the genital tubercle. Then here we can appreciate you can see the urethral folds. And then here we have the labial-scrotal swellings. So first let's talk genital tubercle. The genital tubercle is a small projection on the external body surface of all embryos at the indifferent stage. This is before the 7th week. In the male, this genital tubercle will form the penis. In the female, it gives rise to the clitoris. Now the urethral folds then we can see next. But let's check this genital tubercle out, forming the penis. Here you can see it forming the clitoris, basically. Next then we have the urethral folds. The urethral folds, they flank the urethral groove. Now the urethral folds in the male, they will fuse. They will fuse in the midline, forming the spongy urethra of the penis. They will remain unfused at the tip to form the urethral orifice. Sometimes what happens is this doesn't close, it doesn't fuse properly, leaving then this opening down in here, allowing then urine to make its way out. So let's say here's the penis. Right here then we have this. Oh, I don't want to do that. Okay, so let's do this. So it remains unfused here. Okay, so now that's normally speaking, right? That's what's going to be basically that urethral orifice, the external urethral orifice, allowing the urine to make its way out. Now here what happens is sometimes it remains unfused here on the bottom, allowing then urine to make its way out down this way. It's a condition called hypospadias. So make sure you got that down. In the female, the urethral folds are going to become the labia minora. The labia minora you can see on both sides. The labial scrotal swellings in the male will give rise then to the scrotum. The scrotum. In the female, you've got your labia majora. Labia majora. So here you could see how all 3 systems in the female are found one right after the other. In this view here, you can see you got the bladder, and then you can see the urethra, the urinary system, and then here you've got the uterus and the vagina, reproductive system. So the male, these two are hooked up. And then the female, you can see the digestive system back here. Some reproductive disorders I'd like you to know about. Prostate cancer affects males. We've got the prostate, right? We didn't see that in relation to the female. It affects about 9% of men over 50 years of age. Testicular cancer as well. Most common tumor in men between 15 and 34 years of age. And then breast cancer, you could see in females, you could see 1 in every 8 or 9 women in America. Here, we could see cervical cancer, right, affecting the cervix. That's why we do pap smears. And then also on top of that, sexually transmitted diseases such as AIDS, hepatitis C, caused by viruses.